Welcome to week 13. We're going to talk about population health analytics. As we move along the healthcare analytics journey, we continue to talk about retrospective reporting or basic reporting that shows us what happened, what has already happened. Then we move on to enterprise-wide data insights with foundational analytics, which tell us what is currently happening. Then we move on to predictive and prescriptive, which tells us what will happen. It's a proactive way for interventions and improved outcomes, and eventually cognitive, what is the optimal treatment, and dynamic learning for optimal care guidance. We utilize the same healthcare analytics journey, whether we're talking about clinical informatics, healthcare informatics, public health informatics, or population health informatics. This diagram shows us a typical IT system where we have transaction systems, data warehouse and analytics, and recently within healthcare systems, population management. Population management feeds to and from transaction systems and data warehouse and analytics. Population management can include patient registries. So these can be registries that track information about chronic diseases, case management for complex patients, risk stratification, and other conditions or populations of people. Our learning objectives: be able to define and differentiate between health system, public health, and population health aims, the health of individual patients versus community versus populations of patients. Be able to acknowledge the reason for good data for population health management, health information technology, HIT, inside and beyond the traditional health system. This is a list from Harvard that shows us the difference between public health and medicine, where public health focuses on the primary focus is already on populations. Public service ethic as an extension of concerns for the individual. This is where this goes beyond medicine and healthcare and into social justice and advocacy. There's an emphasis on disease prevention and health promotion for the whole community. A public health paradigm employs a spectrum of interventions aimed at the environment, human behavior and lifestyle, and medical care. Variable certification of specialists beyond professional public health degree, lines of specialization organized, for example, by analytical method, such as epidemiology and toxicology, the setting and population, which includes occupational health and global health, substantive health problems such as environmental health and nutrition. Life science is central with a prime focus on major threats to the health of populations. Research moves between the laboratory and field. Population sciences and quantitative disciplines, essential features of analysis and training. Social and public policy disciplines are an integral part of public health education. And then you can see the differences here with medicine. So how do we define population health? This refers broadly to the distribution of health outcomes within a population, the health determinants that influence distribution, and the policies and interventions that affect those determinants. Population health is holistic in that it seeks to reveal patterns and connections within and among multiple systems and to develop approaches that respond to the needs of populations. Tactics include rigorous analysis of outcomes. Understanding population-based patterns of outcomes distribution is critical to addressing population needs in communities. For example, patterns inform the selection of effective population health management strategies to diminish problems and develop approaches to prevent reoccurrence. Informatics for population health. Populations can be defined by geography or grouped according to some common element. For example, employees within an organization, a specific ethnicity, a medical condition, a geographic location like a city, an urban area versus a rural area, and so on. A person can be, and most likely is, a member of many different populations. Population health informatics must look at multiple determinants of health outcomes, including medical care, public health interventions, and the social environment, as well as the physical environment and individual behaviors and the patterns among each of these, where people live, work, play, go out to dinner, attend meetings, visit, go on vacations, and chronic disease management. These are the 4 pillars of population health. We have chronic care management, quality and safety, health policy, and public health. And you can take a look through these pillars that show who, what, where, and when. This is one model for population health. And you can see here we have public health communities, healthcare systems, prevention and healthy behaviors, care management, quality and safety, public health, and health policy, all working together. I'd like you to try a practice activity. The growth of social media has provided a research opportunity to track public behaviors, information, and opinions about common health issues. Among computational methods to analyze tweets, computational linguistics is a well-known developed approach to gain insight into population, track health issues, and discover new knowledge. Natural language processing is something that's being used not only to look at finding information within large amounts of data, such as a database of literature, but also within social media put out by individual users. You can try this out. Just recently, this free linguistic inquiry and word count tool now became a paid model, but there is a small area where you can try out some information on that website. Analyzing individual level opinions by automated algorithmic techniques can be a useful approach to better characterize health opinions of a population, as traditional surveys can be limited. Sometimes you can't reach everyone. Sometimes people don't really want to answer the questions truthfully, and response rates can be low. And here's a recommended article that you can read as well.